This is the preoperative exercise program. These exercises are recommended to do to get ready for surgery. You may also be instructed to do these exercises post-surgery by your physical therapist. Sit to stand without arm support. This exercise will make it easier for you to stand after having your surgery. Start by sitting in a chair at the edge of it with your feet slightly wider than shoulder width apart. Reach your arms in front of you and start to lean forward until your buttocks arise from the chair. Come to a full standing position. Slowly sit back into the chair. Repeat this exercise 10 repetitions 3 times per day. This is the supine quad set. Begin lying on your back in bed with the surgical leg extended. Place a small towel roll under the surgical knee. Gently squeeze the muscle on the front of the thigh and hold 5, 4, 3, 2, 1, and relax. Repeat this exercise 10 repetitions 3 times a day. Supine heel slide. Begin lying on your back in bed with both legs extended. Gently slide the heel of the surgical leg toward your buttocks. You should feel a gentle stretch on the top of the knee. Slowly extend it back to the straightened position. Repeat this exercise 10 repetitions 3 times per day.